And okay, in Bonn, we have a Center for Environment, Climate Change, and Health. It's a very unique office that is within WHO European region. We are focused in our work for more than 35 years on environmental issues, and I will explain a little bit later on how it grew. And rightly so, we are covering urban green space and blue space, and but now more broadly, nature. And I will show the connection between different approaches, like the nature-based solution and the One Health approach. So I want to provide a little bit today. Let's see that I'm pressing the right screen. A little bit today. I want to depart from some work that we have done on environmental burden of disease. Of course, we don't have estimates on burden of disease related to nature and green space. It's a very interesting exercise to pursue on its own, but I want to mention the burden of disease issue. I want to talk about WHO strategic and policies and frameworks, and also then to zoom in into the work that we specifically did with oftentimes with our colleagues from the WHO Collaborating Center at Exeter University on so this work was surrounded around issues of nature and urban green space, the economics of that, nature-based solution. There's still some ongoing work that I will share with you. And separately, we have done in the Bonn office also some work on One Health, but more specifically on the environmental dimension, One Health. I will not be able to zoom in very deeply on each of and every work, but I will just give you some of the highlights. So I want to start with the burden of disease. And 2.5 years ago, we had the ministerial conference on environment and health in Budapest, and we created this document on that. It talks about burden of diseases on different areas, but also on what WHO can do and what other countries, member states, the 53 member states in our region can do, but also regions and cities in order to improve health that is related to exposure to environmental determinants. So we focused on ambient and household air pollution. For example, you probably know that in our region, 569,000 people would die every year prematurely because of exposure to air pollution. Most of them would live in cities, and the focus of today is the cities. I'm mentioning that because many of the things that we will talk about nature, about ecosystem services, are linked back to those fundamental issues of air pollution, of noise, of wash, of water and sanitation, of chemicals, climate change, maybe radiation less, but also how we can improve the sustainability in terms of the environment and also create climate smart healthcare systems. But we also focus on healthy cities. So I'm not going to show you all the results that we have because it's available in the publication and the QR is there. And I will share later on the presentation and with the organizers, which can be shared also with the participants. But I do want to focus a little bit on the results that we had on the healthy cities specifically because the focus again today is on cities. And we found that key risks to health within cities is related, or first of all, we know that 80% of the people are in our region expected to live in urban areas in 2030. So cities are a major focus of WHO and what's happening in the cities and how you build resilience in cities, etc. It's really, really critical. Noise, more than 100 million people are exposed to harmful level of environmental noise, but that was in 2017. 30% of the car journeys cover less than 3 kilometers and 50% cover less than 5 kilometers. So this is also food for thoughts, how we can increase the green space in order to make people physically active, avoid cars, avoid the pollution, avoid the noise, but also feel, be more emerge with, what nature can offer within cities. So this is another aspect. We also know that there are lots of contaminated sites or areas that are potentially involved in polluting activities and suspected as sites that are contaminated. So we know that there's 2.8 million sites in the EU 28 countries alone that experience polluting activities. And this is another question. Can we convert these lands? Can we rehabilitate the lands, remove contaminants, create more green space? That's also huge practices that we develop here in WHO, how to rehabilitate contaminated sites and repurposing them for open space, green space, etc. Before later on, decades to come, they can be turned into other usages like residential areas, if at all. So this is another place to take a look at. I know it's an expensive thing, but this is has a great potential. We also looked into housing, people still living, almost 15% of the population live in dwelling with leaks, damps, and some other issues that have to do with quality of the housing, which is also affecting them, especially during extreme weather events when we have lots of rains, floods, or even heat waves when insulation is not very good. We also know that this varies between 3 to 63% of the urban population live. It depends on the countries. In the 53 member states lived in crowded conditions. But also we know that only 3% of the total city area comprises publicly accessible green space. Now it's us to judge if it's too little or enough. Apparently after COVID, everybody felt that this is perhaps too little. We also know for different work that was done outside WHO that almost 1% reduction in natural cause mortality could be achieved through adequate access to green space. So there is a promising, indication that actually green space can, within city, can support human health and well-being. Going to some strategies and the internal WHO approaches. So in WHO, the Global Strategy on Health, Environment, and Climate Change was produced in 2020 by WHO headquarters, was calling for transformation that is needed to improve lives and well-being sustainably through healthy environment. The very fundamental thing, it was understood that if you want to guarantee better health, better well-being, you have to work with other sectors. So what we will be talking today, even in cities, green space, it cannot be done without working with other sectors of transport, agriculture, industry, housing, etc. And this governance of this whole thing is really, really critical at the national level, regional level, but also in city levels. But when it comes to the strategic objective of WHO, we are supporting primary prevention. As I mentioned, we do support cross-sectoral and promote cross-sectoral action. We do feel that we need to strengthen the health sector. So not just what the health sector can do in order to make its operation more sustainable and more green, but also to support the health sector with arguments about green space. So when they represented in, for example, national planning committees, they can actually bring the health argument into green space, the health argument into environmental impact assessments, etc., etc. We build support within countries. We provide evidence, but we also make sure that we translate scientific information into more to a format that is more that can be communicated. And we also support countries with monitoring, especially getting data on health impacts. In this context, health impacts related to environmental exposures. But then came COVID. And it was really interesting because the WHO created a manifesto for healthy recovery from COVID-19. You remember probably the Build Back Better or Build Forward Better concept and all those concepts. And the question was, what can we support? What can we suggest from the environmental and climate point of view? And there were 6 prescriptions, and behind each prescription, there are dozens of actions that can be taken. It's all in the publication, and they can be taken also by cities. But it was amazing to see that even WHO felt like protecting nature would be the number one thing. Protecting nature, but the hint behind this now is not just protecting nature so we can promote health, in general in cities with through green space, blue space, nature in general. But also we need to protect nature in order to prevent from zoonotic diseases to spread, etc. So when we get closer with our building cities to and encroach into nature, into natural lands, we also increase the danger that we may have the next pandemic around the corner. So and also nature is really important for physical activities. Nature is important for mental health. So for all of the above, protect nature was the first prescribed item in the WHO manifesto for the recovery, for the green recovery, I should say, from COVID. Obviously, ensure basic services related to wash, shift to clean energy, promote sustainable food systems, build livable cities, and stop subsidizing polluting activities. That was also on the list. Coming back now from headquarters, from the global to Europe, and specifically to how we operate here in Bonn, is that we have every 6-7 years a ministerial conference, and in the ministerial conference, the member states get together and they decide, ministers of environment and ministers of health together, they decide on the commitments that they are willing to take forward in the next period of time in terms of environment and health. The last meeting was in Budapest, and what was special about Budapest that it was not the commitment that member states took, which translated to a declaration that was called Budapest Declaration because it was held in Budapest. The approach was let's stop with the silo approach. We need to bridge between the silos, and we need to also look into the triple crisis of environmental pollution, biodiversity loss, and climate change, which is part of the conversation of today, and see how we can bridge between them, how they are bilaterally connected and trilaterally connected and affecting health. So this was a very different approach during the Budapest meeting than previous years, where the integrated approach was understood that it's almost a must from now on. And member states have decided also to promote nature-based solution, to promote the One Health approach, etc., etc. So the focus now was no longer on environmental pollution, chemicals, air pollution, on climate change, on radiation, etc. Suddenly, the focus has become also on nature, biodiversity, but also on the integration between the three crises. So now we have formally the nature biodiversity laws within the Budapest Declaration, and member states are very committed to improve nature, promote nature, and prevent biodiversity loss. Because everybody understands the linkages now to health. On the climate, also it was the commitment quite a bit expanded. But to bring it to the context of today's conversation, today is about cities, but obviously it meets us where we live, in rural villages, in rural areas, in villages, in small islands or coastal towns, in big cities. Climate change threatens our health. It creates droughts, it creates floods and heat waves, and we know that this is going to be increased. It's going to be more intense, more frequent. We also know that we have vector-borne diseases like malaria and dengue viruses that will increase with more humidity and more heat. We also know that it's not going to be in the time of the year that we expected it before. We do know that vector-borne diseases now is spreading in geographical areas that we didn't meet them before, but also in different times of the year. So basic necessity obviously will be disrupted, like our food, because of drought. Air pollution and pollen seasons will increase, leading to more allergies, more asthma. And this is very important also because we are now want to compensate by doing more green space, etc. We need to be very cautious about it, making sure that we also evaluate the risks of green space in cities, not just the benefit, make sure that we understand the interlinkages with climate in order to prevent vector diseases, allergy, etc., etc. But also we know that we have disruption in water and because of flooding, because of the supply, because of quality of drinking water, etc. And we do estimate that in the next, until 2050 or between 2030 to 2050, climate change is expected to cause 250,000 additional deaths per year due to malaria, malnutrition, diarrhea, and heat stress. And then the question comes, how can cities build resilience towards that? And they can also mitigate it by introducing nature-based solution. So when it comes to nature and green spaces, we identified those pathways. For example, environmental benefits can be achieved by reducing urban heat islands effect, by creating structure, hopefully green structure, using nature-based solution to mitigate floods. We can also contribute with green space to improve air quality. When it comes to nature benefits for humans, we also know that anthropogenic noise can be buffering, and production of pleasant sounds can be enhanced by introducing habitats and ecosystems for birds and for more trees, etc. We also, can deal with UV exposures. We can also create exposures to diverse microbiota. When it comes to social and activity benefits, nature and green space create a place for social interaction, community cohesion, promotes physical activity. So these whole things of well-being, mental health, and physical activities, or this whole envelope of non-communicable diseases is very, very critical. It comes again more specific through the mental benefits, where we enhance nature connection, and better we do it at early age, also teach the children, but also it reduces stress, and we have also attention restoration through nature. WHO, coming back to our office, have produced, as I said, with the help of at least the three reports that they are mentioned here in the left, with the help of our collaborating center in Exeter. We first did work on nature, biodiversity, and health, where we looked into the interconnections. Then we assessed the value of urban green space and blue space for health and well-being. We moved on to nature-based solution and health. And previously, we have done work in WHO, not related to the collaborating center, on urban green spaces and what planners can do. So it's mostly a brief of action for planners. So a little bit, I will just mention what we have done in each of the work. On this particular publication, we looked into essential services like clean water, food, medicine, climate regulation. We looked how biodiversity, and explain how biodiversity loss threatens food system, health, and well-being. We also highlighted how exposure to nature reduces risks of diabetes, cardiovascular diseases, but also mental health issues. We demonstrated how we can contribute to the SDGs 14 and 15. And we also started to hint at that report on the nature-based solution and strategies that related to that. How can we promote it in the future? One of the fundamental concepts in this report is really to look into the ecosystem services. And we took those ecosystem services and we highlighted them, their connection to human health. And basically, when I look at this ecosystem services, I mean, you can interpret it, each and every one of them, from an ecological, environmental point of view, okay? But if you look at them, you can definitely tell the story of health. Every single item here has to do with health, with nutrition, with purifying water, with pollination, I mean, with mental health. Everything is there in the supporting services, in the provisioning services, the regulating services, and the cultural services. So it was a very good starting point to start interpreting how health is really connected to the ecosystem services. Next, we did some work on the economics, but not just valuing the urban green and blue spaces from an economic terms, but also we looked into things that cannot necessarily be quantified or monetized, because we thought that if we are trying to convince mayors or leaders within the urban areas to increase the space for green space and blue space, we need to come with an economic argument because is very costly to invest and to maintain. And we also need to demonstrate the alternative cost of that or the alternative benefits, because the tendency is sometimes, oh, let's convert the land and use it for real estate. But yes, if we are not highlighting the benefits that can be achieved from green space beyond just environmental benefits, but the health benefits, then we may lose the game. So we need to highlight that. If we can monetize it, wonderful. If we cannot monetize it and quantify it, at least in qualitative terms, we should highlight those benefits. So we show how it improves the green and blue space, improve physical and mental health, reduce pollution, heat. We can support social cohesion, physical activity, stress reduction. We can guide the planners and the budget people, the resource allocation people. We can also address risk, including allergies, zoonotic diseases within cities, and safety concerns like drowning, blue space, etc. And we also provide some tools to assess health impacts and economic values. So this is a good reference document for that area. We then moved with our collaborating center to work on nature-based solution and health. Now I know nature-based solution is now everywhere, and different entities within the UN system are looking at nature-based solution, let it be UNEP or the UNDRR, but also non-UN organization like the IUCN, etc. But what we are doing here is specifically to look into nature-based solution and how it can promote health. And again, we took the approach of the ecosystem services, and we showed how air, water, soil quality, disease prevention, and mental well-being can benefit. We also had a special focus on healthcare systems, because it's very important for us to see how hospitals that are contributing to pollution, to emission, to waste, etc., can improve in that regard. We also listed unavoided, how we can avoid unintended health risk when we implement nature-based solution, because it's not all pink and rosy. We need to be aware. But also we highlighted the necessity to reach out to other sectors and work with them on nature-based solution. So that was published in May 2025, and in May 2027, we are going to do the same exercise, but with a little twist. We actually ask our member state, what do you actually need? Case studies, success stories, tools, etc. So we will going to zoom into very practical solution of how to do things, how to evaluate things, how to monitor solutions. So we will be more concrete with actual examples, even though in this report we already have lots of case studies. But the next report in another year and a half will be more on case studies. Going back to work that we have done before that on urban green space, the action brief, it's really for planners. And within the health sectors and the environmental sectors, there are also planners. So it's not just the national authorities for spatial planning, but we help them to identify the benefits, the health benefits, and the biodiversity and communities benefits, which I'm not going to repeat because many of them I already mentioned. We also took a special note on the equity issues to ensure that all communities have green space, not just the rich area, and how we promote safety, and also how we address disparities in availability and quality. But again, the focus here is not for the health sector necessarily, or the environmental sector, but the planners within those sectors and other sectors as well. We mainly wanted to achieve integration of green space into urban planning, and to develop strategy for funding and maintenance, but also set targets for green space provisions and access. One more work that was done in our office, I was not involved, but I just need to want to report to you, is work related to green and blue space and mental health, where we looked into also, among other things, to the number of studies per mental health outcomes per study types. And many of them are looked into effect, many of them are looked into physiological stress, but the work that has been done, the research that has been done out there, not in WHO, but in academia in general, divided to some work that looks into experimental work, some studies are cross-sectional, some are qualitative. So there's a lot of work out there on the linkages between green and blue space and mental health, so that we note of that. And the finding is that it's green space types, all of them have beneficial effects. The beneficial effects were found, quite positive. Positive effects were reported for all green spaces type or perceived stress, except for trees and other plants, because no studies were available. Mental health and subjective well-being were positively associated with all green space types except gardens. And quality of life was positively associated with all green space types except grassland. Restorative outcome yielded positive effects for all green space except for gardens and grassland. And severity of mental disorder was also positively associated with all green spaces types except for urban green space and grassland, because no studies were available. The last item that I want to mention very quickly is about One Health. A few years ago, 3 or 4 years ago, or 4 years ago now, in 2021, OLEP, the One Health high-level expert panel, that is a joint panel that was put together by WHO, UNEP, the UN Environmental Program, FAO, the Food and Agriculture Organization, and UA, the World Organization for Animals Health, has defined One Health, finally defined One Health, or updated the definition. So One Health is not a new concept, but they updated and refreshed the definition. And what is really important is that they put a lot of emphasis on the environmental issues, looking at ecosystem, but the wider environment, including ecosystem, and highlighting the interdependence between human health, animals' health, crops, and the environment. But if you look at the second part of the definition, it's not only talking about mobilizing sectors, discipline, communities, but it also highlighting that we need to address clean water, energy, air, safe and nutritious foods, taking action also on climate change and contributing to sustainable development. So the environment is a very big component within One Health. And obviously the One Health later on was adapted by Healthy City, the Healthy Cities Network, and also cities are now working more explicitly and extensively on a One Health approach at the urban level. If I can say one word about One Health approach and the added value of adding the One Health approach into your system of thinking is really, we cannot really do the work. Vet will do the work of the vet, the epidemiologists and public health people will do their work, ecologists will do their work. But what we need to do by working together and creating bridges between the disciplines and sector is by the 4 C's that we have there. If you see the orange wheels there, we're talking about communication, collaboration, coordination, and capacity building. We need to be able to talk to each other from different disciplines and sectors in order to bring forward the One Health approach. My work in this area is trying to bring the environment and health in One Health, because the veterinarian and the human health were very strong. Zoonosis, food safety, antimicrobial resistance, this was traditionally taken care of, but the environment was pretty much neglected. So then came OLEP and they introduced the joint plan of action with several tracks on zoonotic diseases, on vector diseases, on food safety and AMR, antimicrobial resistance, but then they added another track on integrating environment into One Health. So it's not that the environment is not related to all the 6 tracks, the other 5 tracks, but they wanted to specifically highlight it. Just in parallel, or actually before that, we in the Bonn office looked into the role of the environment and the impact on health within One Health, and we wanted to understand specifically how what is really important, because as I told you, the environment was pretty much neglected. And we unfolded, and again, I don't have the time right now to describe what we did in this work, but it's available for everyone in English, also in Russian. And we unfolded it and we said, well, listen, the One Health approach is more than just infectious diseases. It's more than just zoonotic diseases and food safety and AMR. It also has to do with non-communicable diseases, because when we have pollution, or let's say wastewater, that carries specific metals or mercury or whatever, going to the streams, going to the river untreated, going to the food, to the marine environment and to the seafood comes back to our plate. And especially if you are part of a special group like a pregnant woman and you rely for your protein on fisheries on food from the marine environment, then the immediate effect is on the child, on the baby, and this need to be looked at. So we felt really strongly that this story of One Health is not just about one infectious diseases; it's also about non-communicable diseases. But also, what we did is not only to understand the role of the environment in terms of storing pathogens, in terms of changing and the dynamics within the environment, etc., and the environment is mediating diseases. But we also wanted to understand how land use change, how biodiversity loss, climate change, and environmental pollution affecting diseases, the infectious diseases and non-communicable diseases within this concept of interlinkages between the three sectors of human health, animals' health, and environment. So that's what we have done in this work. So I'll stop here, and I'm very happy to answer questions. Thanks. Over.
Thank you so much. What a really interesting way to kick off the webinar. And thank you so much for setting that strategic scene for us. It's fantastic to see an organisation as large as the World Health Organization taking a real lead on environment and health. I love the push there on, or the highlight on multiple benefits, the multiple benefits of green space across our health and well-being, not just interventions that help people at a certain point in their life, but that support people through a whole life course from a child right through their older age. So thank you so much. And from that policy and strategy base, we are going to now move on to research. And we have Dr. Penny Muraj, who is an associate professor in environmental epidemiology at the London School of Hygiene Tropic Medicine. Her research examines the health effects of changes in the environment and sustainable adaptation and mitigation solutions. This includes quantifying the impact of climate change on health, understanding the complex linkages between people and natural ecosystems, and identifying nature-based solutions that can simultaneously promote health, safeguard natural ecosystems, and achieve sustainable development. So really probably taking the next step of what you have really set up there, Sanaya, Dr. Netanyahu, and moving it into that research piece. So if you can share your screen there, Annie, that would be great.
Yeah, thank you very much. I hope you can see my screen. Thank you for the introduction, and
thank you.
Thank you to Dr. Sanaya, who's I think covered a lot of what I'm going to say, but I think it does complement really nicely. So what I'll do is I'll give a bit of a deep dive into the work that we are doing from a research perspective, specifically looking at it from a climate resilience and also from a human health and well-being perspective, specifically in cities. So I spent many years looking at the interrelationships between environmental changes and human health and really understanding the impact. But slowly my research has taken me into the idea of what are the solutions, what are the climate change solutions, adaptation mitigation solutions. So I'm particularly interested in nature-based solutions because of all the things that the previous speaker has mentioned. They have multiple benefits, multiple impacts. They can address various challenges. But one of the pitfalls of doing research in this topic is that there are clear disciplinary and sectorial divides. So I spend a lot of time trying to work out how to bridge those disciplinary divides, particularly between health, epidemiology, environmental services, and specifically ecology. So there's probably a lot I can say about this, but I wanted to kind of leave you with three key messages at the end of the talk. And the key messages are nature can support climate change through two different pathways, adaptation and mitigation, and I'll be talking a little bit about that. There is a lot of evidence, as the previous speaker has mentioned, but I think the quality of that evidence is always a little bit questionable. And this is because generating the evidence is really challenging. And so I'll give you some ideas of how we've addressed that or how we're approaching evidence generation. And then maybe just to kind of move things a little bit further is, and particularly in the discussion, is that it'd be really nice to talk about how do we move towards that transdisciplinary framework or that way of working where the disciplinary boundaries are blurred. So my first key message, nature has an immense potential to address climate change. We know this is true. There's been a lot of evidence on this, and there's there's different ways that nature provides benefits to human health, but also environmental benefits. I won't talk a lot about ecosystem services because those been covered, but just maybe to mention, if you haven't come across this before, they are grouped into 4 different categories. So supporting services that are linked to biodiversity, photosynthesis, and supporting services are really foundational services, right? Which underpin all the other ecosystem services. Provisioning services linked to how we access food, water, fuel, raw materials. Cultural services, again, linked to how we enjoy nature, whether it's physical activity or education or recreation. And those are specifically linked to things like mental health and psychological distress and so forth. Now, a lot of the work when it comes to climate change resilience are linked to regulating services. So this is how nature regulates ecological processes to deliver services such as cooling effect, flood control, water quality, and so forth. So just to drill a little bit deeper into exactly how nature does that, there's 2 key pathways. And the first one is the mitigation pathways. So we know ecosystems such as forest, peatlands, and also oceans can mitigate warming. They can address climate change primarily because they store a huge amount of carbon, and they also remove carbon from the atmosphere in what we refer to carbon sequestration. And there's been a lot of research around this topic. It's not something I'm engaged with, the mitigation aspect, but the estimates are around up to a third climate change mitigation can be delivered by what we call natural climate solutions. So forests, peatlands, oceans, and so forth. And as you can see on this graph on the right-hand side is that a lot of that mitigation will have to come from how we manage the use of fossil fuels. But again, up to 33% of that mitigation can be delivered by NCS. Now, when it comes to cities and urban areas, there's just not enough space to grow enough trees to deliver this sort of mitigation. So a lot of this NCS mitigation will come from spaces that are outside urban areas. Which brings me to the second pathway that we can address climate change using nature. And this is the adaptation pathways. This has been mentioned before, this idea of urban heat islands. So the adaptation pathway is where a lot of my research lies, and it's the idea that vegetation cover and green spaces can provide cooling. This has been very well demonstrated, and actually, so the graph there or the figure there on the right-hand side shows that cooling effect. So areas that are highly built up, where there's a lot of concrete and very low vegetation, such as the business districts, tend to be a lot hotter. And if you compare that with areas where there's a little bit more vegetation, such as park or indeed rural areas, so there's a huge difference in temperature there. It's up to 3 degrees according to this image. And so we know that vegetation, increasing vegetation cover, specifically tree cover, can help with climate change resilience in cities. So my second message is around the challenges in generating evidence. There's different study design that can be used and that we apply, but I just wanted to share a few examples. Now, a really good way of summarizing the literature in a very robust way is doing what we refer to an evidence synthesis. And you may have come across this before, but I wanted to highlight this paper that I really like. I think it came out 2 years ago, and it's by colleagues from the University of Surrey, working with colleagues from the Center of Ecology and Hydrology. So this idea of evidence synthesis is a really rigorous way of generating evidence. So in this particular study, they screened up to over 27,000 papers, so a huge amount of work. 202 papers were reviewed in full text, in detailed, and they were able to come up with up to 51 blue-green intervention categories. Again, those were grouped further into 10 divisions. So what you see here are those 10 divisions, And they managed to pull the impact on cooling across those 10 divisions. But what I really wanted to highlight is that there's a gradient of cooling, and you can see spaces such as botanical gardens have the potential to offer up to 5 degrees cooling. This is a lot from a health perspective, and certainly a lot from an environmental perspective. Now, even with blue and green spaces that didn't provide a lot of cooling, so this is at the very bottom of that diagram, they refer to them as mixed green and blue spaces. They still were able to generate up to 2 degrees cooling, so which is quite phenomenal. So there's this huge capacity of cooling that we should be tapping on when it comes to green spaces in cities. Now, when it comes to understanding the impact on human health, this is where epidemiological analysis comes in. So this is something that I work on a day-to-day basis, but I wanted to highlight this piece of work because this came from a study that looked at data set across 300 countries. So again, it's like a huge data set. It's modeled data set, but it's coming from different cities across the world. It's a little bit of a busy slide here, but I'll talk you through it. So the first image there is a graph, and it's a way of characterizing the impact of heat on health. And typically what we know from epidemiological analysis is that when it gets hotter, the risk to health, particularly in this case, the risk to mortality increases. So you can see that sharp gradient in the curve on the right-hand side. What they've done here in this paper is they've stratified that relative risk or the risk to mortality by the amount of green spaces. So you can see in the table at the bottom part of the slide there is that there's a really nice distinct difference between the heat-related mortality in areas with low green spaces versus medium green spaces and high green spaces. In a nutshell, then that. At a population level, we are seeing these huge substantial differences between heat-related mortality by the amount of green space. So it's a really, really nice way of demonstrating that. The other thing that we do in public health, in epidemiology, and is really trying to characterize what do we mean in terms of the population health burden? So how many deaths can be avoided, for example? And the way we do this, again, is using modeled examples, using a concept called health risk assessment. And it's actually quite complicated, but I've just tried to summarize it here. It relies a lot on existing epidemiological functions, so relative risk relationship as shown in the previous study. You'll need an idea of what the underlying mortality rates are. You'll need to characterize the change in environmental exposure. So how much, if it's climate change, for example, what is that change in temperature that you anticipate the intervention will generate? And you'll also need an idea of baseline exposures. So when that sort of analysis is done well, it's possible to come up with some figures like this. So the first set there on the left-hand side is a paper that was done in London. It's a couple of years old now, but it was done by colleagues at UCL, and they were able to show that land and urban forest can help avoid up to 153 heat-related attributable deaths per year. And when they drill down a little bit in the heat wave that we saw in 2022, the reduction can be estimated to around 16 deaths. Likewise, similar analysis has been done in places like Barcelona, where they were able to model the impact of a citywide implementation. So they refer to them as green corridors in Barcelona. And they found that by increasing the green space there by up to 3.6%, it is possible to reduce or to avoid up to 178 premature deaths. Before I conclude, I want to give you an example of some piece of work which I think is really interesting. It's around the idea of natural experiments. It's a different way of doing an analysis, so it's very different from the modeled analysis. And I think it's what we should be aiming to do more in the future. So this work is a UKRI funded piece of work. It's across the UK, and we'll have study sites in 4 different cities in the UK. So London, Brighton, Leeds, Edinburgh, and Oxford. So it's a large interdisciplinary research hub. So we have participants, partnerships from academia, from the built environment and from the natural environment. And what we want to do is we want to assess the core benefits of net zero transition. And so really we want to understand, if we move towards this net zero world, what are the potential reduction in health risk associated with extreme heat for vulnerable communities? And we will be evaluating existing or proposed sustainable interventions that can deliver cooling. So an example of those interventions are interventions around the housing and building interventions, such as building retrofits. And the bit that I'm quite closely involved in is the evaluation of nature-based solutions. It's a very complicated and very complex piece of work. But just to kind of summarize, what we'll be doing is we'll be taking intervention sites, such as an example shown on that diagram there, and we'll be matching them to control sites or households. And then we'll be monitoring those households to see whether we can find any differences in environmental outcomes and also in health outcomes. And just to say, the study sites that we are looking at beyond residential homes, we'll be looking at care home settings, hospital settings, and also prisons. The other thing that we really want to understand from this study is this relationship between outdoor exposures and human physiological outcomes. So we know heat affects health in terms of, I've shown you earlier, in terms of the epidemiological analysis. We know that there's an increase in mortality, but really we want to kind of really pinpoint what happens to the human body physiologically when exposed to heat. So we know there's been a lot of studies that have been done from lab-based experimental studies, but there's very little when it comes to kind of population studies. And this diagram here shows the kind of the pathways from heat exposure to what's happening in terms of the cardiovascular strain, renal strain, things like dehydration, sweating, and so forth. In this study, in addition to measuring very detailed measurements on outdoor exposure and indoor exposure, from the human and health physiological perspective, we'll be taking very detailed measurements on skin temperature, heart rate, core body temperature, blood pressure. We'll also be evaluating sleep quality. And in addition to that, we want to understand heat health behavior using a questionnaire, as well as well-being health assessment. So very detailed measurements on a very small sample. So it's not the usual sort of epidemiological studies that have thousands and hundreds of thousands of studies. So this will be a very small sample of up to 200 sample sizes. And again, we want to align what's happening in the outdoor exposure, so heat, relative humidity, air quality, with what's happening indoors, with what's happening physiologically. Okay, so moving on to my last key message is this idea of really needing to move towards transdisciplinary framework. This has been mentioned before, so I'll just go through it quite quickly. So we've been spending a lot of time trying to think about this, and I worked on this paper with colleagues from UNEP, World Conservation Monitoring System, in really trying to understand how do we bridge those disciplinary divides. And one thing was quite clear is that we need to move to a world where we are agreeing conceptually, so this idea of conceptual integration, but also in terms of the methods. And just to drill in a little bit into us, this idea of conceptual integration, one of the things that we found doing this piece of work is that there are different conceptual frameworks that are used when it comes to health, public health, but also in ecology. So on the left-hand side is a framework. It's called the Deep Sea Framework. You may have heard of it. You're probably very familiar with it, but it's a framework that we apply specifically in epidemiology. But when we had a bit of think about that, when we apply deep sea from an epidemiological perspective, they tend to be an emphasis on the adverse effects on environmental exposure. So I teach a lot on epidemiology, and a lot of the time the focus is in the harmful effect of nature. So we look at air pollutants, we look at naturally occurring hazards such as radon, arsenic, UV radiation, and so forth. Ecology, on the other hand, focuses on nature's contribution to people. There's a lot of discussion on ecosystem services, which is really nice. The caveat there is that we found that the literature is still inaccessible to public health, so it needs to be communicated in a way that health understands. So there's this idea of drawing from the existing conceptual frameworks and finding synergies moving forward. I won't go into a lot of details about methodological integration. Maybe this will come up in the discussion, but we did try to define 4 core ways that we can try and align our methods between health and ecology. So this idea of defining shared objective between both disciplines, joint metrics and indicators. It's really difficult sometimes to do analysis when there's spatial temporal differences in health outcomes versus environmental outcomes. Having open access, existing resources, whether it's data sets or inventories or assets. And this idea of integrating how we look at assessment and how we consider assessment. I think in public health, there's a lot of emphasis on joint strategic needs assessment. So there's a thinking about how those can also incorporate ecosystem assessments. As I conclude, I just wanted to say I think we're still a long way from fully integrating disciplines. There is a lot of evidence, but a lot of that evidence is really from model studies. One of the things I'm really passionate about is really moving from model studies to this idea of natural experiments and building impact evaluations on existing or proposed interventions. There's a really nice piece of work that came out, I think it was last year, and I really like what the researchers concluded from this systematic review of intervention. And they say that researchers should be coordinating with community stakeholders before starting greening projects to develop evaluation strategies. So I think a lot of those projects are evaluated, but a lot of that evaluation probably should be coordinated with academics. So it's a bit more rigorous, I guess. And the last thing I want to leave you with, this is really important, I think, is that we really also need to be thinking beyond just urban areas. I know this session is just for urban areas, but ecosystem services and nature is really transboundary. And I love this image because it shows that some of those ecosystem services that we enjoy in urban areas are actually being generated elsewhere upstream. So whether it's from forest or from wetlands. So this idea of the connectivity of nature and the connectivity of ecosystem is really key. And so as you're thinking about what's happening in cities, I think it's really good to realize that we might be enjoying those ecosystem services, but actually we don't really have control of where they're coming from. All right, I'll stop there and I'm very happy to take questions.
Brilliant, thank you so much. I think it was really fascinating. I'm always a big advocate of ensuring that we are supporting models and research and robust research, which helps inform our own decision making and vice versa. So it's great to see that. And you mentioned their accessibility of literature and ensuring that academics are working really closely with stakeholders and community organisations and partners. And we have really benefited from that here in Belfast with Queen's University and through the Groundswell Consortium, and can see the huge impacts of having those links between community and voluntary, public sector, health and academics. So thank you so much for that. And that leads me nicely on to our final speaker, last but not least. And an organisation, a speaker, and a project that is close to my own heart. So we have Michelle Bryans, the Chief Executive of Eastside Partnership, the leading regeneration charity dedicated to transforming East Belfast into a vibrant, inclusive and thriving community. Joining the organisation originally in 2015, Michelle managed the flagship Consortia Community Greenway project through Eastside Greenways, and since becoming CEO in 2021 has led the strategic development of a range of initiatives designed to enhance quality of life across that area. Other flagship projects under her stewardship include CSO Square and Eastside Visitor Centre, all helping to open up green spaces, celebrate local culture and heritage, and strengthen connections between people, place and opportunity. So we've heard from our policy and we've heard around research, and now we're going to hear from Michelle around how all of that actually plays out in reality and in practice on the ground. Thank you, Michelle.
Sorry, Jackie, yes, I'm just coming on now, and my video doesn't seem to be working. Sure, my picture, but it's okay.
That's great. We can hear you.
2 seconds.
No worries. Take your time.
I had everything up, ready to go, and sure, when we jump on, this always happens, doesn't it?
It is, and you know, you were saying beforehand that your Wi-Fi connection can be a bit funny where you are, and we're all really relying on technology for webinars sometimes. And if anyone, this is just a little moment to give a quick reminder, if anyone has any burning questions they want to fire into the Q&A or the chat throughout the next presentation, we will have a bit of time for those at the end. Oh, there we go. Thank you very much, Michelle. I've got you up on.
And can you hear me okay?
Can hear you, yeah, and see the presentation.
Great, Jackie. Thank you very much for the opportunity to speak today. And I'm delighted to speak about Connswater Community Greenway, as you mentioned, is a big flagship project, not only for us in Belfast, but has certainly been recognised nationally and internationally, and was just featured in one of the policy papers that was just mentioned in the first presentation by the WHO. So really delighted to speak today about how strategy and policy and planning can come into action, and really what impact that has on the lives of local people, and I suppose how then do we share our learning across other communities across Belfast and beyond. So, Connswater Community Greenway for us was always about addressing real impact, and right at the core of that was around health and well-being being really core. But as an organisation, you touched on that, Jacqueline, Eastside Partnership was established 30 years ago, and a big part of our work was always around tackling deprivation. And in order to do that, over the years, we've developed a variety of projects that really touch the hearts and minds and lives of local people. And they include physical regeneration as well as social regeneration through improving education attainment and health outcomes. And a big part of our work is around improving the physical environment in our open parks, places, as well as neighbourhoods and inner city communities. A big focus of ourselves is also around cultural regeneration. So how do we make sure that East Belfast is seen as a destination and a place whereby people want to open up their business, visit and explore. And just this week, Sunday Times has featured it as one of the most upcoming desirable neighbourhoods to visit, which is great to see. We were also described as hipsters in East Belfast, so that's certainly a change that we've seen over the years. And linking into our overall strategy, I suppose everything that we do is about making sure that East Belfast is thriving, connected and welcoming. And we want it to be a place where people want to live, work and invest, that people are connected in a social sense, but also connected in a physical way, and that we bring visitors to the area to celebrate East Belfast. Just to touch on what has already been spoke about in some of the previous presentations and why we do the work that we do, despite real positive change in the area, East Belfast, like a lot of cities, internationally, even in terms of urban places, we still suffer from high levels of social economic need, and some of our wards that we're working in still sit within the top 10% for health deprivation, low education attainment, and a poor physical environment. And a big part of what Connswater Community Greenway has been doing over the years is to really tackle those tough issues. And I'll come on later on in the presentation with our long-standing relationship with Queen's University, which has just been wonderful in terms of how we are demonstrating evidence and impact. But it's about that inequality piece of green space, and we've improved our green physical environment, but in urban neighbourhoods that is lacking, and there's a lot of research behind that around the link between green space and deprivation. And some of that data is saying that with every 1% increase of green space in a geographical area, the annual count of preventable deaths amongst those most deprived neighbourhoods was lower by 37 to 41%. So Connswater Community Greenway, I just always love to show this slide because a lot of you will not be familiar, but I suppose this was a big driver for why we want to change, and this goes back 10 plus years around what our community in East Belfast was watching and viewing as they were going about their daily lives. So we had major flood events in the area. We had an urban blue and green system that was definitely not fit for purpose anymore. It was a poor physical environment, and I suppose those pictures just scream the real challenges that we were facing as a community. And what we have then created as a result of that, and the idea of the project, I suppose I often say it was ahead of its time in terms of what we're talking about now around climate adaptation, building resilience and climate change. The idea of the project goes way back to the 1980s, whereby you can see a water system that was extremely poor, it was full of debris, etc. And as a community and as residents and people living here, we really wanted to change that. And we draw a lot of learning from neighbourhoods in London, for instance, and had fortunate opportunities to visit the High Line in New York, for instance. But as a regeneration charity, people living in deprivation deserve to have a physical environment that serves them well, and certainly our river system wasn't doing that. At the time, we were very fortunate in the early 2000s, or I suppose mid to late 2000s, that the National Lottery Fund announced a substantial funding bid called Living Landmarks. And as a result of that, we submitted a £23.6 million application, and were successful in that. And we still remain the National Lottery's highest ever investment into Northern Ireland. And as a result of that match funding, then we were able to draw in funding from the Executive Office and Belfast City Council. And what became a project that was about river restoration became a much more ambitious flagship project, that is a strong example of a green and blue nature-based solution. And it deliberately works with natural systems, vegetation, soils and water to address environmental, social and economic challenges all at the same time. It integrates green infrastructure through parkland, trees and habitats with blue infrastructure across a highly urbanised area of East Belfast. What we have implemented is a flood alleviation scheme. It's an active travel route. It has enhanced biodiversity. It is a cooling system. It has multiple health benefits. In terms of supporting local communities, we champion sustainable food, sustainable travel, sustainable energy, sustainable housing and sustainable economy. So it remains post build and construction an exemplar project whereby people are continuing to learn from. And in order to bring the project to life, just want to go through what this looks like in reality. So we have developed a 16-kilometre footway and cycleway. So you can see children there on their way to school or potentially on their way home from school. But we often describe it as an outdoor community centre at times. So as people are going about their daily lives, they are up and close with nature. There is 40,000 residents who all live directly along Connswater Community Greenway, but what they're now able to do is hop on a bike, hop on a scooter and go to school in a more active, healthy way. River restoration, which came a bit, not majorly later in the project, it was always our ambition to clean up the riverbeds. As I said, you've seen pictures, it was full of debris, etc. And this is one of our main parks that had always existed, but a river flowed through that park, and the picture to the left, you can see how close that was to nearby residents. A big part of Eastside Partnership's role throughout the project was around community engagement. And when we were going out to consult with local communities and residents around the design and what the project would achieve, we were hit with severe flooding in 2007, 2008 and 2009. And the community rightly said to us, it's great that you're cleaning up the river, and isn't it great that you're putting in new connections in order for us to get about the area. However, our homes are flooding. And as a result of that, we put the project on hold and we lobbied government, who agreed to an £11 million flood alleviation scheme. So you can see whereby the picture to the right, the river has now moved into the middle of the park. It is a natural flood defence system. It means on heavy rainfall days, this park will flood as opposed to flooding the nearby residents. And that has had a huge biodiversity impact as well. We have our wildlife residents, we have herons, egrets, kingfishers, all sorts of wildlife that people in an urban environment are up and close with. And probably nearly every other day we have avid photographers who are sending us in those photographs. And again, this is just a photograph of the moving of the river. I suppose we talk a lot about flood alleviation now, and you can see the fact that 1,700 properties were flooded and the real positive impact that's had, not just environment, but the economy. And a lot of those properties, right up until the past few years, were not even able to get home insurance, and now they're able to do so. Outdoor play and recreation. I suppose when we're talking about climate adaptation and building resilience, we're talking about people, and often greenways are described as active travel routes. For us, greenways are so much more than that. They're about building a community around them and having multiple regeneration benefits, and making sure that the outdoor space is as interesting and engaging as possible has always been really, really important to us, that while people are on their journey, they're able to stop off and do things. So and making sure that children from the age of birth right up until adulthood are able to get outdoors. And this play park was a big investment into the area, and probably in terms of all the communities who live along the Greenway would suffer from the highest levels of, of social deprivation. So it was really important that we were able to give that back to them. We've installed 26 new or improved bridges or crossings. We had parkland that was not accessible, and the community many years ago would have, created little cut through. So building bridges was really important in order to be able for people to get across the river, and that connectivity is really, really key. We remain the first 24/7 opening linear park in Belfast that is lit. There's a lobby at the minute for other parks in Belfast to be open in the same way. And at the time, there was challenges and residents worried about things like antisocial behaviour. However, in doing that, what we have now created is a park that's been able to be used any time of the day for people who are getting up really early to go to work, or people who are up late in the evening. And again, that's been really important for active travel and physical activity. At the heart of the project is a public space that we call C.S. Lewis Square. C.S. Lewis is from East Belfast and very close to this space. But again, in terms of what defining a character of a place is public space. And again, this isn't unique to other cities across the world, but it's certainly unique to us in Belfast, and it's very unique to us in inner East Belfast. A lot of the properties and homes in which people live do not have gardens, and as a result of that, people now describe the Greenway and C.S. Lewis Square as their outdoor garden. And a big part of our role over the years has been about bringing that to life through events and activities, etc. Just a wee bit back to what made the project work and those learnings. Political buy-in was always really key. We were very lucky. There was substantial investment. The community and stakeholder engagement really helped shape what the project would be and what outcomes it would achieve. Eastside is a place-based organisation, so we're really, at the pulse and the heart of what the community needs. Israel has been really tapped into partnerships with local government and council, and again, strong partnership working across the sector was a huge benefit. Some of the key indicators that we've developed from inception was around what impact it would have around the environment, what impact it would have the economy, the social impact, as well as health and well-being. And upon completion of the project, a lot of physical regeneration projects like this, we often move on to different things. However, we wanted to take a sustainability approach. And when the project completed in 2017, we continued to work as a charity to work with local communities to make sure that they were benefiting, mainly from a health and well-being perspective, but also that the space would be well used. And how do we bring a community with us? So we adopted a bit of a strapline around helping local people live a green way, and we continue to do that today. We, in terms of our staffing, we have a manager to the project as well as heavily embedded in community engagement. So we do lots of different things, whether that's community cleanups, we do riverfly monitoring projects from large events, engaging with local schools. And a big part of that is, we always do that through an education lens. So while we're out engaging with the local community, are we able to talk about what different choices, behaviours and attitudes do they lead that would help them lead a more, I suppose, environmentally conscious and healthy lifestyle. Upon completion of the project, I suppose we're still lobbying for wider Greenway development in East Belfast and develop this strategy. We want to make sure that every resident in the community is very, very close to safe and accessible transport. And climate action. About a couple of years ago, I suppose, as the project's evolved, what we have then seen is actually what role does Connswater Community Greenway have as a nature-based solution, again, to engage the local community. So we got some funding and worked with a local consultant to come up with a future vision around climate and nature action. And we done that alongside the local community. So the local community were invited into a wide variety of events and workshops and help shape what the outcome of this would be to lead us into the future. And you can just see there's some of the photographs of that engagement, which began with local community leaders as well as children as young as primary school. And some of our, current priorities now are around how does the Greenway be a driver for eliminating emissions, capturing carbon, strengthening resilience, further biodiversity, raising awareness, research and sustaining activity. As I mentioned earlier on the presentation, we've been very lucky to have a long-standing relationship with Queen's University Belfast, who've carried out multiple research and reports over the lifespan of the project, and we are delighted to launch a final report in May this year. And how they've done that is through a variety of household surveys, economic evaluations, evidence synthesis, qualitative workshops, etc., and stakeholder analysis. And I suppose that's definitely shown us the real impact and transformative change that a green and blue intervention like Connswatter's had. And I suppose that then helps shape policy and other projects elsewhere. And you can see here some of the data that they have been able to provide us with around, as a result of Connswatter Community Greenway, what impact that has over 40 years around things like chronic health disease and preventing deaths as a result of people being more active. I suppose just to finish where we are now as a project, we're always evolving and changing. And again, the lottery are definitely our friends, because we just applied to another UK-wide fund. Some of you may be familiar with it, it's the Climate Action Project. So we have just started a 5-year programme that will link climate action even further to the everyday lives and interests of local communities and inspiring them to take action. And will that work help them think a wee bit differently around like things like sustainable food and living more, even greater, healthier lifestyles. It will have ability to influence communities at a regional or local or national level, as well as linking groups up across different locations and hopefully inspire people across the country. And we also obviously want to be inspired by those elsewhere. It will deliver neighbourhood-led projects with the scope to feed into or shape citywide, regional agendas and policy projects. And that's me. Thank you.
Brilliant. Thank you so much, Michelle. You can really see through your presentation, it's captured a lot of what both of the previous speakers have mentioned around those multiple benefits of urban green and blue spaces and nature-based solutions, not just physical, but social and cultural, but also the impact that research has had on both developing and continuing to drive forward what happens there. So thank you. That is our 3 presentations, and now thankfully we do have some time for questions and answers. So we have one in the chat from Neve, and this is for Sanaya, if she is able to respond to this. So I am wondering if you have insight into how we can meaningfully embed One Health thinking in our respective research areas. So Neve is coming from an academic background. You mentioned the 4 C's: communication, collaboration, coordination, capacity building. Should we ideally be taking this 4C approach from the outset of planning and proposals? For example, inviting collaborators from other disciplines at idea generation stages. And can we still embed those approaches in One Health thinking at the later stages of our work, if not? I hope that makes sense. It is in the chat there in the Q&A, Sanaya, if you're able to see that, but if you are able to respond.
Yeah, I'm able to see that. I'm just trying to figure out what should we really be taking the 4C approach.
I think the question is, should you be taking that approach right from the outset, or is it possible to integrate it later into your plan or your proposal or your research?
I think both. I mean, it's not one or the other. I mean, you can benefit from doing both. I mean, we don't have to artificially structure all those things. I mean, some of them are organically happening as we go along. Some of them need to be introduced, but at the end of the day, we need to keep it in mind that the communication between the sectors, the collaboration and the cooperation needs to be done. But the capacity building is also, it's not that we are going to teach each other, it's on the disciplines, but we need to be able to reach a level of communication between the, so basic awareness, raising awareness is also really needed. But I think also when we are trying to do right now, when we have a community of practice on return on investment of One Health, And we were trying to ask ourselves, what actually are we are measuring? I mean, what is that you're measuring when you're trying to measure the One Health in terms of return on investment? So the investment, the added value is really about this interaction between the sectors. So it's really tricky how you measure this added value. So because monitoring, let's take something surveillance monitoring, okay? Each sector is doing it anyway, right? Now we are asking them, let's merge the data, let's merge the systems. So this is like the added value. So this is a cost that is added to that, but there's also benefits of analyzing integrated data. So I think that if we're not going to do that, if we're not going to measure that, we wouldn't really know. But the integration and the collaboration is extremely important in plannings, in proposals. I think that in today's environment, we can see that in the pandemic fund, right? There's a pandemic fund. Proposals that express those issues of collaboration, coordination, interstructural understanding, capacity building on laboratories, on surveillance, are gaining more points, so to speak, and they look more promising because you can see that really people are going to walk the talk, not just doing it without a true collaboration. Okay.
Yes, and true collaboration, as you say, is often built into the structure of what you're doing and not as an add-on. But thank you very much for that. I hope that answered your question. I have one here for Penny. I know I saw one in the chat there, and I know that was aimed at both Michelle and Penny, and Ruth Hunter and Penny have responded to those. Unless you want to add anything more to what's been said there, Penny, in that question.
Yeah, that's a really good question. I think the question is on whether we've done any work on understanding the impact on health services and the cost implications. And no, we haven't. I wish we could. And it's a really important question. We get asked that a lot. A lot of the work that we do in the UK, particularly the work funded by NIHR, is linked with UKHSA. So that is a question that we get from UKHSA and DHSC and others. It's difficult to quantify those things because you need to work out exactly what's being impacted. So you could say you could look at hospital admissions. It wouldn't cover everything because some people don't even present to hospitals from the exposures. But I have seen a lot of the emergence of evidence on this. So I've been reviewing a lot of publications, and there's one that springs to mind, which was a really interesting one because they looked at an intervention that was implemented in Scotland, and they wanted to understand the impact on health services by linking environmental services data with prescriptions data. So looking at whether there's an increase in mental health prescription. And I think that was a really interesting approach. But yes, so watch this space. I think there's a lot more interest and a lot more evidence emerging, but it's not something that we've specifically done.
Yeah, and I know Ruth had responded, Dr. Ruth Hunter responded in that chat around that in relation to Consulta Community Greenway. And just to mention for anyone who's on the call or on the webinar who's not aware, the Groundswell Consortium is a research consortium which come into its last year, and there's a lot of research and evidence that's going to be coming out through that work, and some of which may link to just that question as well. Just stay there, Penny, because I have one more just follow-up question from ourselves for you. How do you think we can use natural experiments to actually measure if climate adaptation interventions have been successful, or do you think we can?
Yes, so you can. It really depends on what intervention, and it's really will be guided by the study design. So when it comes to natural experiments, and there are probably others who are more expert at this than myself, the study design does matter a lot. So the one that I talked about, because we're not implementing anything. The approach we are taking is looking at control and intervention sites, right? That's one way of doing that. It's really tricky, right? Because you want the matched controls to be very similar to the intervention sites, right? The way I would do it, and again, this is really difficult for nature-based solutions, is having a before and after, so pre and post. So collect baseline data sets before the interventions, and then down the line after the intervention has been implemented. Again, with nature-based solutions, really difficult because it takes a long time to see the benefits, a long time to implement. But if you have finite resources and you want to take that longitudinal approach, that's the one I would use for. I would go with, yeah.
Thank you very much. And I have one last question. It's going to be for yourself, Michelle. So often through nature-based solutions, we're focusing on the tangible outcomes, the tangible outcomes of flood alleviation schemes, of new increasing biodiversity and offering green corridors. But the Greenway, I know, and you mentioned it yourself, touches a little bit on that kind of cultural shift that nature-based solutions can do within a community in relation to climate change and in relation to the environment and health. Just wanted to see if that's something you have noticed through the work of the Greenway, and if you can touch on that a wee bit more.
Yeah, I suppose our application to the Climate Action Fund is a really real sign of that, because all of our work is around responding to need, and some of that, the research and evidence really supports that work. But as community leaders working on the ground, we respond day in, day out to what we're seeing and what we're listening to, and our engagement through the years, the project. When we were always looking to the future, we probably didn't think we would evolve into this. We thought we were maybe going to evolve into something else, but actually we always need to adapt and respond to that. So day in, day out, you can see even in the most, deprived communities, the conversation is happening, which is good. But there's still a lot more work to do. There's a lot more work to do in terms of how people, choose to travel despite having this big infrastructure project. As we have a very, very busy arterial route that flows right through it. There's high levels of air pollution. There's a lot of flooding still goes on. So there's a lot more work to do, but I definitely often call it a bit of a movement and a bit of a shift. And I suppose East Belfast, in terms of Belfast as a city, people will look in and go, right, well, it's become a very green, environmentally focused way. And there's other small charities have popped up who are doing great work around food security and, and food banks, and really just having that conversation. And for us, that's what it's about. It's about raising awareness, starting to have a conversation, because as we know, we're not going to actually totally address climate change in a global way, but actually what we do have the gift to do is through smaller scale interventions, just make life better for people who live here, improve their health and well-being, and improve how they connect with their local communities. And mental health is still a very big, prevalent issue. So as a result of a project like Groundswell, can we really, support local people? So
brilliant. Thank you very much. And that brings us up right on time, which is fantastic. I don't see any more questions in the chat, but if anyone has any follow-up questions they'd like to think about this after, they'd like to ask the panelists, please do send them through to our info email that you received a link to, or to my own if you have it, and we'll try and answer that and continue the conversation. So just to before we close, I just want to thank you again to all of our panelists for taking the time out to share the work that you're doing and the inspirational projects that you're working on and how you're kind of leading this conversation. I found that really, really interesting, some really rich stuff coming through all three speakers, and they all kind of, you could see, flow into each other and really do make that strong link between policy, research and practice. This is, as I mentioned before, the first of our webinars for 2026. It's also the first of a series of 3 webinars that we are delivering, just so that you're all aware of that. In February, where we are hosting a second webinar. I think it's on the 19th of February, but don't quote me on that. It will be promoted in the next couple of days, and you will receive a link to join that webinar next week alongside this, the recording of this one. And the title of that one is Greening the Grey, Temporary and Tactical Urbanism for Healthier Cities. So hopefully you'll be able to join us at that. And thank you very much for coming along and spending your lunch with us today. Thank you.
Thank you very much. Bye-bye.
Thank you. Goodbye,
thank you.
everyone.
Bye.